Welcome to VW Healthcare World. Modern lifestyle, increased use of gadgets, decreased physical activity have led to increased spinal pain and conditions. But can one prevent them? On the occasion of the World Spine Day, Dr. Swati Bhatt, a pain management specialist and also the managing director of the Indian Pain and Spinal Center, IPSC Bangalore, is here with us to discuss about symptoms, causes, treatments of the various spinal conditions. Welcome, Dr. Swati Bhatt to VW Healthcare World.
Thank you. Thanks so much.
Dr. Bhatt, my first question to you is that, people know that we have a changed lifestyle, there's a lack of movement, we're having desk jobs, work styles have changed. And a lot of it is related to or is known to cause back pains. Can you share with us what kind of back pains get triggered in these kind of conditions?
Mostly back pains which get triggered with increased or excessive sedentary lifestyle or ergonomic ways of work are mostly musculoskeletal in origin, which mostly involve the muscles and the ligaments of the back of the spine. Now, there's a constructive group of muscles which form an intermediate or the larger group or the smaller group of muscles. Mostly, these are the group of muscles which can get affected in due course of your work life if it's not really ergonomic or you're slouching while you're working, you're not sitting upright, etc. So these are most often to be affected ones, and that's how they trigger the pains.
And Dr. Bhatt, we get a back pain, it gets triggered off. We normally relate it to, maybe we haven't slept well or we haven't had the right posture while sleeping. The mattress may not have been nice. I'm tired. When should someone seek professional help to manage the pain?
See, most often when back pain or neck pain is more acute in nature is when we call it within an occurrence of a few days to a week's time, within which the body has its own innate mechanism, either to get relieved of this pain after a restful sleep, or else with medications, this pain should go away. It is when this either medications or rest is not helping you out, that means this pain is going more in terms of chronicity, longevity. That is exactly when you should be looking at taking a consultation from an expert.
But Dr. Swati, we are most of the time confused about who do we go to. Traditionally, whenever we have a back pain and we feel that we need a professional consultation, the first thing we think of is in orthopedics. And over the last few years, we started seeing a rheumatologist, right? And now we have a pain management specialist. How is pain management different from orthopedics and rheumatology? When should someone with a back pain visit a pain management specialist? And when does rheumatologist come into the picture? Just for a little bit of a clarification, maybe you can help.
Yeah. So when you're talking about a pain management specialist, these are the group of people or physicians who have had an advanced training into various kinds of pain as they occur in the body, be it related to any of the systems. So it could be the headaches which arise out of any cranial pathology. It could be spine, it could be neck pain, it could be arm pains, it could be gynecological pains, it could be cancer pains. So that ways, it is the pain management specialist or the pain specialist who is the best person to come to a conclusive diagnosis as to what is underlying the pain, or what is the pain generator, as we call it. The precise term is pain generator. So once we identify what is a pain generator, thereafter we need to look into how to relieve the symptoms and what underlies the cause of this pain also needs to be addressed. Say, for example, if it's a gynecological, if a patient has an endometriosis and related pains arising out of that, as a pain specialist, after conducting a thorough examination and investigating the patient with certain markers or radiology or biochemical tests, thereafter plan a protocol for the patient, how to get relieved of the symptoms of the pain, and whatever needs to be addressed, which is the underlying cause of this, would be addressed by a gynecologist. So I think that is the way forward, going from any specialty. So coming back to your question, what you asked me, most imperative is to go to a pain physician once he or she figures out the pain source for you, whether you require a rheumatologist or if it's an armamentarium of a spine surgeon or if it's an orthopedician, should be the call that a pain physician can take.
So basically what I hear you is that if you're having a pain, if you have a back pain, go to a pain management specialist. They will be able to identify the cause of the pain, and then accordingly, either they will treat it or send you or refer you to the right person who could be of help, right?
Right.
Dr. Bhatt, what is it that you do which is a common treatment option for someone who comes to you with this condition? And what pains do you think can be managed with painkillers and interventions at your end, and what conditions require a deeper intervention?
See, I would say more often than less when it is a systemic cause. There are multiple systemic causes like which relate to rheumatology, etc. There would be a need for maybe a lifelong management in terms of medications, which would keep the immune system under control and check. And from time to time, either these medications need to be increased or decreased in their dosage or duration of time that you are taking them for. The other way of looking at medications would be not to put a patient on medications, because every medication has its own metabolism and related side effects out of that. So at best, have the medications for a very short period of time as best as possible. And that is where the essence of interventions come into play. When we are talking about interventions, we do more of target specific therapies. So wherein if it's a nerve related issue, we address the nerve pathology. If it is a herniated disc, we address that. If it is a degenerative spine, wherein small joints or large joints are affected, we go and identify the troublemaker or the pain generator and give a target specific intervention over there, wherein the dose required is very, very less. The side effect profile is hardly anything. I mean, it's got a best profile in terms of side effects, nil side effects arising out of the medications. So the patient is back on the track very fast. There's very little requirement of any bed rest or any cutting or any hospitalization. So I think that ways it helps a lot.
And Dr. Swati, people have been suffering with back pain for a very, very long time. It goes ignored. Do we have a different kind of a treatment protocol when it comes to long-term pains versus short-term pains?
Yeah, as I mentioned already, anything which is acute, say, for an example, if a patient has had a muscular spasm or an injury, which should heal over a period of time or a stipulated period of time, you can just leave the medications alone for a span of that time. And when we are looking at long-term or chronic painful conditions, that is where I think interventions or an intervention pain physician has a very large role to play.
I don't know what could be the repercussions for someone if they ignore the back pain or a spinal pain for a very, very long time.
I would say it's not only limited to spinal pains, pain all over the body, wherever they exist. If they are left untreated over a prolonged period of time, there is something called as neuronal plasticity, which is developed in the nervous system of a body. So this is the nervous system which deals with it's the feedback system, or it is that highway which connects the entire body with the higher center, which is the brain, as it perceives what is coming to it as signals, and the overall perception is that of pain. So when we are looking at anything like which is chronic over a period of time, it develops plasticity. Plasticity means that this nervous circuitry undergoes certain anatomic changes or morphological changes in the body, and they no longer transmit these signals only when they are excited. They will start transmitting these signals rapidly at even a basal level or even at restful conditions. That is when pain becomes a disease of its own. And if left untreated, this is going to result into a painful condition or neuralgias with which patients will suffer throughout life. The pain tolerance or the pain threshold for such individual comes down very drastically. In other words, or in simpler words, I can say that the person who had a pain earlier with a very high stimulus, after a prolonged period of being in pain, will respond to pain even at very, very slow stimulus. So very small needs to be given to incite these kind of painful responses in the individuals. So these patients become painful even at restful conditions, and they start living with pain throughout life.
Mm-hmm. And Dr. Bhatt, what advice do you typically have for young mothers and pregnant women in case of spinal issues when they come back with big back pains?
One of the commoner excuse, or I should say a complaint, which comes to my clinic when it comes when there are young individuals coming or younger females coming in, maybe after a pregnancy or a delivery, within a span of 2 to 3 years of time. Most often people attribute this to the spinal anesthesia or the needle which has been given, which has pricked the spine, and they always assume that this is the cause of the pain. The actual cause is not so. It's our lifestyle. Again, womanhood or motherhood, whenever it comes into play in the life, it's a very challenging situation. No doubt, ladies have to go overboard to take care of their kids, while in the nighttime, breastfeeding, abnormal postures of sleeping, sleepless nights, all this contributes to the backache per se. Besides that, during the course of pregnancy, the body undergoes a lot of changes, physiological, anatomical changes, by way of different hormones that play or come into existence, which are normally in circulation so as to allow a normal delivery or a normal birthing process. In the process, what happens is these ligaments become very lax, the muscles become very lax. Once after the delivery is over, what is very, very imperative for all these women is to get back into a very, very good shape. The muscles have to be conditioned, strengthening has to be done for it to get back to its original shape before how it was during pregnancy. This is one of the commoner causes of the laxity of these ligaments and muscles and joints, is one of the major causes of back pain in the post-pregnant women.
And Dr. Bhatt, what is spinal cord stimulation?
Okay, spinal cord stimulation is one of the very advanced techniques wherein we stimulate the dorsal lemniscus column of the spinal cord, which can generate or which signals the brain, and the brain perceives these signals as only stimulation, or what we call it in medical terminology is paresthesia, which is nothing but just a vibration sensation, but it is not uncomfortable as pain. When we are doing these stimulations, the idea is based upon the gate control theory of pain management, wherein the smaller signals which are carried by the pain controlling or the pain carrying signals, which are slow fibers, we call them as. So once these fibers carry the pain signals, eventually an individual suffers from chronic pain. But the gate control theory, when you use it in this, it only allows certain kinds of waveforms, which is the high frequency, or which is the vibrational sensations. So thereby it depresses these painful signals, but only allows these vibrations to be carried to the brain. So it is basically just disengaging the brain from the painful signals, but it engages more with the vibration sensations, and therefore the patient does not feel the chronic pain that he was otherwise suffering with. So there are different kinds of stimulations that we do. The basic idea about the spinal cord stimulation is how I have explained it as. And there are various forms of stimulations. There's something called high frequency stimulation. There are low frequency stimulations based upon what the individual is suffering from. These electrodes are placed up inside the spinal cord, and they are and there's a generator, power generator, which is placed inside the body of the individual. It's got a battery inside it, which generates these impulses. And at the end of this whole process, the patient has a great pain relief.
These are certain things that have come actually from audience where while we were researching for this, conversation. Another one thing that we have been seeking some kind of an understanding in a layman's language is radio frequency ablation. What do you mean by this?
Our painful signals are carried from anywhere in the body to the brain by a circuitry system, which is called as the nerves. These nerves are nothing but, it's just like the electricity wires which are spread up all in your house as such. So wherein once you switch on the bulb, the circuitry or the electricity goes all the way up throughout the house, and whatever needs to be lit up. If there is anything which goes wrong with this neuronal circuitry, if there's a wrong cross connection, eventually there is going to be a lot of problem in the way the things are being lit up. So the same thing exists in the body as well. By radio frequency ablation, what we are going to do, or what we target doing, is we numb these nerves so that any amount of these unwanted or cross talks or cross circulations do not happen. And that is how the patient receives the pain relief. Usually radiofrequency ablation is not a permanent thing wherein the nerve is not damaged completely. The nerve is depressed to the extent that the effect lasts for about a year and a half, depending upon the technology that we have used. There are different forms of radiofrequency ablation. There's something called pulsed radiofrequency, conventional radiofrequency. There's even something which is called cooled radiofrequency technique. So depending upon the technique that we are using it gives a different time frame. The idea is, while it depresses the painful sensations in the body, it allows the individual to go back to a good lifestyle wherein he or she individual uses rehabilitative techniques as well as to increase the circulation of a body. At the end of all of this, what we achieve is a good healing of the body. The body also has its own healing mechanism. So usually what happens, it is the pain which generates more pain, and it's a vicious cycle. The more the pain, more the systems which get affected, and it leads to more sedentary lifestyle, circulatory disturbances, increased obesity, etc. And that is what does not allow the body to heal. Once you go pain-free, it allows your body to do all the rehab process which is required for a healthy healing of the individual. So that is how this works.
And Dr. Bhatt, we've heard this term called regenerative interventions. Can you explain that to us, please?
Yeah. So in our body, as I mentioned, it already has a mechanism in place wherein the body regenerates itself, or there is healing. So whenever, for example, you have a cut or an injury in the body's system or the cells they promote growth, and that is how the body heals, whether it's a cut, whether it's a trauma, or anything for that matter, or an infection, etc. So what happens usually is when we are looking at degenerative conditions, whether it is the spine or it is any other large joints in the body, or it may be any traumatic conditions which are called microtraumas, which can happen over a day-to-day life, or because due to stress factors which play due to our work life, it can lead to certain microtraumas in the body, and because of that we can have small tears, etc., or bursitis or inflammations of the ligaments or various tissues in the body or muscles, etc. Now, with regenerative therapy is nothing but your own cells of the body, but better and concentrated. So the idea is to take up the blood from your own cells, we centrifuge it, whatever good cells are there which are required for the healing of different tissues which have undergone this trauma, we inject them in a concentrated manner under a fluoroscopic guidance or an ultrasound guidance, which is much better than giving it without any guidance at all. We do not know where the tear is. But now that we have all these technologies, we see it under all these guidance, and we target specifically, go to that area and give these cells, giving it a span of time of around 2 to 3 weeks for it to heal, before which we may go for the second injection of the same. The idea is that these cells will heal the tissues which otherwise may not, due to certain factors, like I said, already mentioned, sedentary lifestyle, and there are joints, etc., wherein the circulation is not as good as any other organs in the body. So there we use these regenerative techniques.
And in what kind of conditions do you recommend that the patient will need a surgical intervention?
Very clear-cut guidelines are there, wherein we know that any condition may not heal either with medications or with interventions, wherein we think that there is some underlying anatomic difficulty or anatomic abnormality which has to be healed. Say, for example, listhesis of the spine, where there are fractures of the small joints in the spine, which may not be possible to be corrected on its own or with an intervention. That is a clear-cut guideline to be going in for surgery. So wherever any interventions is not going to help the patient, wherever there is an unstable spine, those are the conditions wherein you need to undergo a surgery. Spinal canal stenosis, again, is another condition wherein there could be multiple reasons which could be contributing factors for this canal stenosis symptoms, which could be a facetal hypertrophy, it could be ligamentum flavum hypertrophy. The canal is quite small and there's a disc herniation which is making it even more compromised of a spine. So those are the conditions wherein you need to operate and make the way bigger for the pain relief to be there, and likewise any other symptomatology like motor dysfunction or sensory dysfunction that needs to be taken care of. So those are the conditions wherein we would not keep the patient for interventions, and that is the condition wherein I would ask my surgeon to come into way. Another reason for this would be if I'm looking at anything in the spine which is more suggestive of metastasis or a malignancy, that is again a condition wherein I would want to involve the surgeon and take an opinion on that, and probably it might result into a surgical removal of the tumor or a cyst, etc., depending upon the condition.
And Dr. Bhatt, you use the term pain relief. Now, what I want to know is, can these pains be completely got rid of? Can a person be cured of this pain? Or if not, in what conditions do you think the pain can be completely cured? In other conditions, how long do you think people typically remain pain-free after getting a treatment?
See, again, going back to where we started, when I said chronicity, the more chronic a condition, it results into latency or difficulty of the condition being treated completely. So if you've had an individual has had a long term of disease or pain period, by then neuronal plasticity has already developed, and these kind of pains become very difficult to treat. So we expect somewhere around 80-85% of a relief from interventions in these cases, and remaining whatever pains are there may need some form of medications to have a good relief or complete relief from these. More often, if there are acute incidences or subacute incidences wherein a patient has suffered in recent times of a year or two, and there's not much of a plasticity which is developed, then in those cases, we expect much better results in these individuals, and almost up to 95 to 100% pain relief is achievable in these individuals.
Awesome. And Dr. Swati, since we are moving as healthcare towards preventive, what do you suggest people do to take care of their spine? Any tips that you'd like to share with our audience?
Yeah, so there are a few tips as to having a good, healthy spine. One is make sure that you do not have a sedentary lifestyle. So every time you are sitting on your desks for work, whether it is in the banks or you are in the IT sector, you're sitting right in front of the computers, or you may be a doctor treating other individuals. The rule book is same for everybody. Every 35 to 40 minutes, get up, walk around, come back, and be seated on your chair. So do not extend your sitting more than 35 to 40 minutes. Be more active, be more vigilant towards having a healthy practice of having either anything. It could be yoga, or it could be hitting the gym, or it could be just walks in the morning and evening, which goes a long way for maintaining a good circulation. It'll avoid your excessive weight gain as well. Besides that, drink a lot of water, stay away from more of alcohol and smoking. These are the factors which are risk factors for degeneration of the spine and the discs. At the same time, whenever there is anything which is bothering a painful condition of the spine, back or neck, which is bothering you for more longer time, always consider taking a expert opinion from a pain physician or somebody who is an expert in that field.
Absolutely. Dr. Swati, it is extremely important that, whenever you have a medical condition, whether it is affecting your body, it's a pain or a condition that is troubling you and your body, the first thing you need to do is to go and get a professional help. Do not take decisions on your own, because you could be doing more harm than good. Dr. Swati, before we let you go, what would be your message that you'd like to share with our audience on the World Spine Day?
I always mention this, a healthy mind and a healthy spine is always what is required for a healthy living. So as long as you take care of this, and we have specified in more terms or more words than less today. So take care of your spine as early as possible. Do not wait for conditions to become very, very worse. Take expert advice as early as possible. Be responsive towards your spine, not only today, but throughout the year and throughout your life.
Dr. Swati Bhatt, thank you so much for your taking out time to be with us today and speak to our audience, explaining certain terms that were too technical for our audience to understand. And gratitude to you for taking out time despite your busy schedule.
Thank you so much for having invited me over here, giving me the opportunity to raise out my voice to all the people sitting over there who want to know about spine health. And I think, I hope my talk was simple enough for people to understand. So if there's still any further queries, I'm always reachable on our website as well as on the chatbot. Anybody can always connect with us.
Great. Thank you so much, Dr. Swati. Thank you.
Thank you so much.